Welcome to Real Talk with Sarah. I'm your host, Sarah Roberts, and today we are covering a topic that can feel like the elephant in the room. We're talking about trauma. If you've ever found yourself wondering if past events have played a role in your mental and physical health, or if you simply want to learn how to deal with traumas in your own or a loved one's life, or if you want to know how to help yourself or your children process trauma better, then this is the show for you. I've got psychologist and trauma expert Dr. Shelley Jordan joining me to help us define trauma, both big T and little t trauma, so that we can identify and name it as we embark on a healing journey. I've also got Theriault, founder of Tranquil Acres, sharing how equine therapy can help people heal through his 4-day retreats. And later, I have Tara Hagan-Fields explaining how our bodies can hold on to trauma and what we can do to learn to release it. It's a jam-packed hour, so let's do this. Episode 6 of Real Talk with Sarah starts right now. When we hear the word trauma, our thoughts can automatically turn to major accidents or incidents, sexual trauma, or PTSD. But we can experience trauma even in seemingly small events, which can have a lasting effect on us. Being aware of how trauma shows up in our lives and learning how we can deal with our trauma is a huge step towards healing. I've got clinical psychologist Dr. Shelley Jordan with me to help us define trauma and better understand its impact on our health. Welcome, Shelley.
Thank you. It's great to be here.
I'm so happy to have you with me. I want to know, and I think our viewers want to know, what is trauma? I think we hear the word a lot, and we don't really understand it. So what is trauma?
When we talk about trauma, there's probably kind of a clinical way of defining what trauma would be, and maybe in my field we might call it big T trauma. So these are traumas that are either life-threatening or something that would threaten somebody's, we say, physical integrity, like their body or their kind of, their safety, that sort of thing. So when we talk about big T trauma, it would be things like natural disasters, motor vehicle accidents, sexual assault, physical assault, any first responders or military who've been in operational duties where they have to be exposed to any kind of experiences where they've seen people hurt or injured or attending to those types of things. Life-threatening illnesses could be big T trauma for people. So those are some pretty broad-based categories of big T traumas that people will experience.
And then what would little t trauma look like for people?
So a little t trauma might be something that, like, probably all of us have experienced little t trauma. Maybe not everybody, hopefully, has experienced big T trauma. We always say, like with our kids, they'll probably experience a little T trauma, and we would want them to have some of that because maybe it could build resilience. So a little T trauma might be you're out driving and you get in a fender bender and everybody walks away and no one was injured. It could be really scary and you could think what might have happened, but you walk away and, without any major repercussions of that. Other things might be, your child's riding their bicycle and they fall off. Or some people might think that life stress could be called trauma, and so that might be debatable, like you have a divorce or you lose your job. So some people would find that quite traumatizing and they would feel perhaps quite stressed or traumatized by it. Some people might not call that trauma, but certainly it's difficult to deal with.
Yeah.
Right? So those might be a bit different because they're not kind of a threat to our safety, so to speak, but maybe a threat to our emotional safety, if we could call it that.
And so does that matter, whether or not it's defined as trauma or not? Does it just matter how it feels to us individually?
To a certain extent, although we know from both research and clinical work that a disorder like post-traumatic stress disorder, you would need to have sort of a big T trauma in order to get that diagnosis, and usually the kinds of symptoms we're looking at with that would probably come from big T trauma because they're specific to that kind of life experience.
Can you share what those are? So when we're looking at PTSD specifically, so that's post-traumatic stress disorder,
Right.
What defines PTSD?
So post-traumatic stress disorder, PTSD, has kind of symptom clusters, if we could call it that. So they kind of go based on the experience that people have. So the one we hear the most about are what are called intrusions. And so when you hear people have flashbacks, that would be a type of intrusion. Other intrusions would be nightmares, memories, thoughts of the trauma. And so it's like people get haunted by the experience and they can't get it out of their head. And what we look for with PTSD is that in the first few months after any major life experience like that, most people can't get it out of their head. But if it lasts a long time, then that becomes a problem. And we would maybe call it a disorder. So that's one of our symptom clusters.
And I've heard with PTSD, one of the best ways to, I guess, avoid getting those symptoms or avoid getting a full-on diagnosis of PTSD, if you've gone through something traumatic, is to talk about it right away. So is that the case would you agree that anytime we've gone through something traumatic, if we can talk to somebody about that experience, is that something that would help?
It could help. It doesn't help everybody, and it doesn't always heal people. So talking about it, connecting to others when we experience a major life event, such as a trauma, really can help us, but there's times where even doing that probably isn't going to be enough for people. So what we know is that when the trauma is really big, unusual, a lot of trauma. So if we take some of our military personnel and they were in places like Afghanistan or Sudan or Rwanda, it's just so much trauma that can, in and of itself, just coming home and telling their story to family members or something wouldn't be enough if they could even tell their story. Because sometimes the story is just too much to be able to tell somebody, and especially a loved one.
Yeah, and I was going to say is maybe it's not even all that beneficial to go back and to relive that story.
Maybe not at the time, because what can happen is that when people talk about the story, then they end up kind of back there. And if they're not coping well in the here and now. So that's where we look at our other symptom clusters, like if they're having a lot of major anxiety or anger and their whole nervous system is disrupted. We say PTSD is an injury at a whole bunch of levels. So the body, Tara's going to talk more about that later, right? The nervous system, which would be how we react, like the fight-flight system. So what happens, the fight-flight system gets disrupted and it doesn't come back to normal after the trauma. That's what happens with PTSD. So then we get a lot of anger, anxiety, people are hyper-aroused, edgy, everything sets them off. And so those are the kind of symptoms we would see, this hyperarousal problem that people have, and they can't seem to settle their nervous system. And then when they have intrusions, what happens is that just sets that whole system off. So that's the nervous system injury. Then there's the emotional injury, so things like guilt and shame, and we see a lot of that with sexual assault, for example, that people feel terrible, just that they're a bad person, and they feel it like not just in their mind, but in their whole emotional system. Lots of anxiety, fear, anger. Those are the main emotions that people would usually feel. And then there's the mind injury or the psyche, which is how you see yourself, how you see the world. People become very afraid of the world, very disillusioned about humanity, about, whether are all men bad, are all people bad? Am I able to walk out on the street? Can I send my kids into the world? So these are some of the kind of cognitive issues that people are dealing with. Am I a good person? Did I deserve this? Those kinds of things.
And so in your work, how do you help people to heal?
So I primarily work in a model called cognitive behavioral therapy. And I work with fairly complex trauma, although trauma is almost always kind of complex. But there's maybe if you have, say, one motor vehicle accident in your adulthood and you have a really good history, maybe that would be a less complex. If you've had a lot of trauma, or go ahead.
No, keep going.
If you've had a lot of trauma or a difficult history, and then you have major life trauma in your adulthood, that might be more complex because you already maybe have some difficulties in your kind of way of handling the world, if we could say it that way.
So you're saying that people that have had traumas all the way along, they have never developed a healthy way of dealing with traumatic events. throughout their life.
Yeah, and then they would be more vulnerable to another traumatic event.
So thinking about, you were talking about people display anger, they have guilt, they have shame. A lot of addiction issues as well come from.
Yeah, so what the addiction stuff is that often when people are really feeling emotionally intense, especially difficult emotions, or they get these flashbacks and intrusions, what drugs or alcohol can do for people is numb the system, make you feel better, turn it off, help you sleep, and so then it can become a way of coping with all of these intense experiences that people can have.
Yeah, so now we're dealing with the root cause of the trauma, but then we're piling on top of that addiction, drug addiction, alcohol addiction, sex addiction, food addiction. On top of it.
Which is really difficult.
Yeah, so how in your work do you unpack these layers with people?
So primarily we try to work with teaching people how to regulate their emotions more effectively.
How do we do that?
You were talking before the show about breathing, so learning how to breathe to activate the part of the nervous system that's outside of the fight-flight. I mean, that's a fairly simple thing, but learning how to recognize that you're even having emotions. I kind of take it for granted that people understand emotions, but a lot of people don't understand their emotions. They don't know if they're feeling angry or anxious and what's the difference. So learning how to actually recognize emotions, being more mindful, like being in the here and now, learning about how to be grounded. So we talk a lot in the PTSD world about grounding so that you're here. So you're not there, you're here, and then you work from here to look at the past.
Because when we have dealt with trauma, of course, trauma always has happened in the past.
That's right.
We're going back there over and over and over again.
Right. Yeah, and so people need to learn how to be here, to recognize that they're feeling a certain way in the here and now, how to regulate that if they can, and then that can help them to process what happened back then. But when you're trying to process what happened back then, all you do is have a flashback, then you get overwhelmed, and then the mind can't process. So we do have these natural mechanisms of healing, and some of the things that help with the natural mechanism is connection to others, nature. By others, that includes animals, by the way. So,
beautiful.
Many people I work with have their dog who saved their life or their cat who helps them to ground. And a lot of people now have service animals that really help with that. So connection to others really helps. Nature, having a purpose, which is difficult for many people after trauma because they feel that maybe they've never had a purpose or now they don't know what their purpose is. Being able to learn new things, being able to connect. These are all ways of having things to look after. So even if it's a plant or a fish, that helps with healing. So what we try to do in therapy is promote the natural mechanisms of healing so that people can process trauma, which is a natural mechanism, that's why some people don't get PTSD, because they naturally work through the experience.
I guess I was
using
thinking
these things.
Yeah, I was going to say that people like in our military and first responders that are dealing with these kinds of traumatic incidents on a daily basis, but some of them are okay. Some of them are able to manage that, and yet others, they go through a really extreme situation, or maybe not even that extreme situation, but all of a sudden maybe there's a compound effect.
Yes. And with military and first responders, it's a bit unique in that they have so many exposures typically throughout their career to trauma that it's hard to kind of avoid getting affected by it over time. Some people they get maybe lucky in that they don't go to the bad calls if they're a police officer, like the really bad calls. Maybe they're all bad, but the really bad calls, or maybe they've never been shot at, or that somehow they can kind of get a bit unscathed, but it's difficult in those careers to come away unscathed.
I know.
But sometimes people just have the right kind of biology or the right kind of support system, or just like everything kind of is there that they might not get PTSD. Some people are dealing with it as they go so that they don't suppress quite as much. That might help.
And I just think there's so much stigma especially with our, with military first responders, people that are supposed to be able to handle this kind of stress, that when they do struggle, there's almost that stigma that they don't want to ask for help. They don't want to be seen as weak. And I think even in the general population that we don't want to be seen as weak, or we wonder why we can't handle this. What's our problem? What's wrong with us?
Yeah, and that is a question that people ask themselves, like, what's wrong with me? Why did this happen to me? And the number one answer to that is it's because you got traumatized. So my way of explaining it to people is, if I take a hammer and I hit your knee, would you say, I don't understand, Shelley, why is my knee injured?
Yeah.
Why me? Why did that? But people will get injured. So the psychological injury is going to happen to most people who take that kind of blow. And the bigger the blow, the more likely the injury. And it's very difficult to stop that from happening.
You mean it's very difficult for all of us to not have some kind of trauma in our life? Or
most of us will probably have some kind of trauma.
Yeah.
And for certain kind of levels of trauma, it would be very difficult to be able to stop it from injuring us in one way or another. But just like with our knees, some people will get injured more. And if you take repeated blows, then, like, if you've had many traumas, then it's more difficult to recover from that, right, in a way that's really healthy. But people can recover. And some people do really well in their recovery. So that's maybe the good news.
Absolutely, that's the good news. And so the recovery can come in all forms. There are all sorts of ways that people can recover.
Absolutely.
And in your practice, it's cognitive therapy. It's talking it out. It's really going, deep into the emotions of it and the feelings around it. And talking with a therapist that can really let them know that this is not a moral failing.
Right.
Yeah.
And therapy itself is just, one part of the puzzle for people. Most people are doing many different kinds of things in their lives to help. So it's kind of the multidisciplinary approach is probably one of the best things that we could see, so that people have a kind of a team or family and people helping them along the way. And one of the things that therapy does is it gives people maybe one anchor and a way of guiding them through the process. And then they have to do, unfortunately, all the hard work.
And it is a lot of work, isn't it? It's like, it's so much easier to drink or to take drugs or to shop or to just avoid.
Absolutely.
But we have to look at this stuff. We have less than a minute left. Tell us, if we have children, how can we recognize if they have experienced some trauma?
So with kids, probably the number one thing to look at is, are they afraid to do things? Are they feeling sick a lot, and that's not typical for them? Have they actually had a traumatic experience? Because we would probably know about it as parents, that they've experienced something. And so if they're feeling sick to their stomach, if they're having headaches, if they're anxious kids and they're saying, I'm afraid, if they're crying more, if they're having a hard time sleeping without coming to your room a lot, and that's not typical. So you could see the behavioral changes, and if that lasts a long time, that would be like maybe over a couple of months, then you would start to worry.
I wish I didn't have to stop you. Thank you so much for being here, Shelley.
Thank you so much for having me.
When we come back, I've got Ryan Theriault here. Back in a moment. Welcome back. If you're just joining us, we're talking about trauma. And I've got the owner of Tranquil Acres Therapeutic Equestrian Farm, Ryan Theriault, with me to share his program that helps people heal from trauma in a unique way using horses. Welcome, Ryan.
Thank you.
I am so happy to have you here.
It's very exciting.
You know how much I love you and how many times we've been out to the farm. I want to know, you deal with people that have all sorts of mental health issues, but a few years ago, you started the Heroes Equine Learning Program. I'd like for you to share, what is the program and who is it for?
Yeah, so the Heroes Equine Learning Program is especially for military personnel and first responders that are affected with PTSD or operational stress injuries. And that program is a 4-day residential program that assists our military and first responders to kind of get some healing techniques, some healing tools to be able to heal through their trauma, their PTSD, their operational stress injuries.
So tell us what happens if I'm a military personnel or a first responder who suffered PTSD. I don't have to pay for this retreat.
Exactly.
That's amazing. I know it's all donation based, so it's incredible.
So the HELP program is a not-for-profit charitable organization now. So we just recently got our charitable status. So therefore, so we're offering this program at no cost to our participants to attend these 4-day confidential retreats. And we're really lucky that we have one in the Ottawa region. And so when they come, all the meals are provided, the treatment is provided, the accommodations is all provided as well at no cost.
So tell us about the treatment itself. What are people experiencing?
Yeah, so the main nugget of what we offer at the HELP retreats is the equine assisted psychotherapy. So what that means is we participate in a therapy session with horses in the farm setting. Therefore, so we practice an international model called EGALA, and that's the therapy model that we facilitate, and it's all done on the ground.
Meaning that people are not riding horses.
That's correct.
People are just standing, and the horses are around them.
So it's facilitated on the ground with the horses, and the horses become metaphors, become significant others that they may see the horses as themselves. They may see them as the trauma. They may see them as who they want to be, where they want to be. So it's kind of a live show.
It really is a live. It's so amazing, and I have had the benefit of experiencing it. Of course, you took me through it. So when you're saying they're metaphors, so people get to decide on their own who the horse represents.
Yes.
So there's no right or wrong, and there's no one telling people who the horse is representing in that moment, if it's mother, if it's father, if it's partner, if it's child, if it's themselves, Yeah,
it almost like role plays, or real plays, a snapshot of their life and where they're at. It's very solution focused. So like you said, there's no right or wrong way. And that is the huge empowerment of this approach, is able for the participants to be able to know where they're at and to put the solutions out there for themselves. So when there's a group, everyone can have their individual kind of therapy treatment in a group setting. So someone might see it as a positive thing, and the other person might see it as a negative thing, and it works that way.
What do you mean they might see it as a positive thing? What's the it?
For example, we have a miniature donkey into the session.
He's the cutest.
And he represented the joy for one person, and then also on the other side, another participant seen as the bully of her workplace harassment. So therefore, it was able to be that, and so they have their individual kind of type of approach and vision on that metaphor. So that's kind of how the process is able to work, because they put the solution onto that for themselves.
It really is amazing, because you are the equine specialist, so you know what the behavior of the horses is normally, and then you also see when the behavior of that horse changes. So tell us about how horses are big, huge biofeedback machines.
Exactly. So they provide that biofeedback right away. So someone might say that that horse is really far. It's kind of like my family member. So when I walk into the room, everyone leaves. So then it kind of facilitates that. So that's a really harsh kind of emotion to be able to realize. So I work alongside of a mental health professional as well. So we've co-facilitated the sessions, and then so we may put the question out there. So who or what is that in your life, and and how are we going to change that? So we're not going to find the solution for them. The client is going to find that solution for them. So it may take that complete session that is about an hour and a half long, or it may take several weeks for that to happen. So in the sessions, we have a total of 6 equine sessions. So we have 2 equine sessions a day, and each session kind of follows through from one to the other.
And then I know that in the retreats you also have yoga therapy, and you're also doing other types of things alongside the horses too.
Exactly. So we add wilderness therapy. mind-body movements, also a lot of metaphor building. So they're able to kind of build that metaphor toolbox for when they leave the retreats, that they're able to have some coping mechanisms so they can have some additional tools in their toolbox when they leave. And then they're always welcome to come back as well to a second one or a third one, and so on. So when they come the first time, they're kind of like family. So you know, we support them. If they need anything, they're able to reach out again. So there's that continuous support as well.
Well, and of course, I've been to many of the gala events, and I know what this is doing for people, so it's absolutely amazing. It seems so strange to use horses, but it works. All right, after the break, Ryan's going to share his personal story of how he came to be doing this work. Back in a moment. Welcome back to Real Talk with Sarah. We're talking about trauma on this show, and I've got Ryan Theriault with me to share his own story of how horses can help people heal. So Ryan, you've always had a love for horses. I know this about you. And several years ago, you decided to quit your fancy corporate job and buy a farm.
Yes.
So can you share with us your personal story of how horses helped you to heal?
It started, I always knew that I had a passion for horses, and I knew there was something magical about horses. And then finally, as a young teenager, I was able to work and buy my own lessons and be around horses. And I really discovered why I needed that. And, you know, it really honestly saved my life. To be able to, you know, I would skip school, run to the farm, because school was very difficult for me. And to try to, you know, where am I going to fit in school? I know, you know, I pretty much self-diagnosed myself at this point that, you know, ADD, ADHD.
And that's why school was difficult for you?
It was very difficult, and also trying to find myself as well. Who am I? What am I going to be? All of that as well, so to try to figure that out. And then when I was at the barn, everything would just kind of, you know, everything was good, and it kind of grounded me. It kind of found, you know, I would find myself when I was at the barn. And I didn't have them rationing things going through my mind. And school, you know, I couldn't sit still. So not that it was, you know, but I wish that I would have found that when I was in elementary and kind of having them coping skills. So I really self-taught myself with the help of horses to be able to kind of find that grounding and finding that level. And I always wanted to be a police officer, and I had the privilege of working with the RCMP for several years, and then kind of seeing you know, what that impact is, and also growing up in a military family, and how my grandfather, that was a World War II vet that sailed across the world and fought into World War II, how that affected him. So that's kind of where finally I was like, I really need to kind of follow my dream and to buy a farm and help others, and to be able to deliver this you know, this magical kind of resource and therapy treatment.
Oh my gosh. Well, I'm so glad that you found your calling. I'm so curious. So you were a teenager and you self-diagnosed that you had ADD, ADHD.
I didn't know at the time.
Yeah. Did your parents ever say anything about?
No. You know, like, you know, it was always like, you know, my report card that, you know, Ryan is not standing still, he's not listening, he's not, you know, he's not engaged, all of that kind of thing. And you know, like, I couldn't sit still to do my homework at night. It was always, you know, I couldn't focus, like, you know, I had to read a book for a book report, and, you know, like so I was, you know, sent to resources, you know, I was also put in detention, you know, all of that. So I was by far the star student at school. So it was that's probably, you know, one of the worst nightmares that some of the teachers had. And then now, in working in that population, you know, we see a lot of children, we see a lot of adults, and I'm like, wow, this, you know, this was me. And, you know, if I would have had these resources, to be able to help me, but the horses really did the work. So when I found the horses in my mid-teens, that kind of helped me through and kind of refocus and kind of save me from, from suicidal thoughts because I didn't fit in into, the school groups, being bullied. Then, I became the bully because that's what I thought that you had to do to try to be able to fit in. So I seen the two roles there as well. It was quite interesting, and that's kind of what.
It's interesting that I feel like the horses have allowed you to become who you really are.
And it's really finding what you want to do and kind of, what feels right for yourself. And so that's kind of why I'm so passionate about what I do is, waking up every morning and doing what I love doing is helping other people that want to kind of heal and finding different ways of, if the in-office setting is not for them, or it can be an add-on to what they do into the office as well. So
yeah, that's a really good point, that for some people who just don't find cognitive therapy isn't what they want to do, they don't want to talk about the trauma, they don't want to go through all of that pain again, but being with the horses allows them to have that connection.
Exactly.
And it seems crazy when you hear about it, right? Like, I had only just heard about it. My father mentioned that he wanted to try equine therapy several years back, and I thought, yeah, that sounds interesting, I guess. And then I sought you out because you were in my area and I wanted to find out more. And you talk about horses being the best secret keepers.
Exactly.
Right.
So a lot of people that can't share what they've seen or done, so especially our first responders, our military, children, sexual abuse, that stuff that you don't feel comfortable sharing to someone else is able to kind of share them stories with the horses. And firsthand, I experienced that. So, having, different things in life that you don't feel comfortable sharing to other people, that, they may react differently, or they may say that, you have to talk to other professionals that you may not trust. The horses will never tell your story to another human being. So I'm sure they mingle with each other, but for sure they won't tell your story.
And what's so amazing about them, what you've taught me, is that again, with the behavior of horses, all they want is congruence.
Exactly.
If you're feeling sad, they want you to display feelings of sadness.
Exactly.
If you're feeling joyful, they want to see joy. But if it's incongruent, that's where horses aren't comfortable at all.
It's amazing because we can tell. A lot of times we see people that have lied through their therapy for many, many years, and horses will call them out on it. And it's amazing what the horses will do is, a lot of times I've seen some clients that the horses, they can't even approach them. Every time they try to approach them, they move away. And the minute that they own up to their real story and then they own it, then the horses are like, whew, just
amazing.
like magnets.
I wish that we didn't have to go, but after the break, I've got Tara Hagan-Fields with me to talk about trauma and how it's... Welcome back to Real Talk. We're talking about trauma and how it can show up in our lives. I've got myofascial release therapist Tara Hagan-Fields with me to share how we can hold on to trauma in our bodies and what we can do to release it. Welcome, Tara.
Hi, thank you.
Thank you for being here. So I just experienced myofascial release in your clinic on Friday. It was quite amazing. I want to know, how are we holding on to trauma in our bodies, and what is myofascial release, and what is fascia, and all the rest of it? So here we go.
Yeah, here we go. So as Dr. Jordan was talking about earlier, the big T's, the little T's. Our body is pretty good at finding ways to keep trauma stored in our system. How I look at it as a massage therapist and fascial therapist is I look at the body and treat the body as a fascial system. The fascial system, or the fascia itself, surrounds every muscle, bone, organ, blood vessel, nerve, right down to that cellular level. So when we experience trauma, whether it's a major traumatic event, big injury that you had, big car accident, fatalities, symptoms or experiences like our military or first responders would experience, that's stored in our system because our body compensates in how we receive that information that's in front of us, whether it's a fall, whether it's something visual in front of us that we see. We go into this fight or flight mode within ourselves, and that has a storage capacity to continue on throughout our life, our experiences. The little traumas, again, we experience them. It could be a small fall where you had going down the stairs, or you twisted an ankle when you were 12 years of age playing soccer. Our body at that cellular level will always compensate. So we remember tissue pain. We remember the moments of, as we experience moving forward in life itself, we remember that past injury of spraining that ankle, or what was taken away from us in that moment, what we lost in that moment. So a lot of the patients that we see, they're coming in with something that just continues on. It might be an injury that they're having immediately, or it might have something related to injuries that they had in their past, but they're not necessarily aware of that. And that's what we're sort of experimenting and what we're trying to find when it comes to the myofascial release.
So tell us a little bit more about fascia itself and what it looks like and where it is. So you're saying it's around everything.
It surrounds everything. It sort of looks like a spider web around our system. It's got the fascial components is elastin, it's collagen, and then there's this ground substance, gel-like fluid surrounding everything. When we have these episodes that put us into those moments of fight or flight.
So give us an example of this episode. Like, we're driving and we almost get into an accident.
Yeah, we go through a bracing mechanism. We slam our foot into the brake. Our hands immediately go on the dash or on the steering wheel itself. We might be looking behind us in the steering wheel. We might go back to brace our child that might be in the back seat. Our system, so that fascial system, which is continuous, allowing those cells to flow, allowing that movement to happen, freedom of movement to happen, goes into that freeze mode. And in that freeze mode, we recognize we are still living or we're not still living. Either injury happened with us or injury didn't happen with us. But there's always that pause of our cells stopped moving in that moment, and then they continued moving forward.
So in that example, there was not a physical trauma.
No.
It was a near miss. We were driving. We almost slammed the foot on the brake, gripping the steering wheel, grabbing our child, and then everything's fine. But something has happened.
Something has happened.
Inside.
Something has happened inside. And we can express it later on as anxiety. We can express it as unknown fears without really knowing what's bringing up these emotions. It could be breathing episodes where we hyperventilate in these moments of another episode of a car accident that's coming on, or we're walking around the mall and we see something that might trigger us. Because that cellular level, our tissue memory is there to remind us that something happened, and we remember that something. Anything can trigger us along the way. So we look at that and we see patients continuously experience different episodes in their treatments as they release throughout their treatments, whether it's with the physios or massage or osteos, those kind of releases itself.
So when you're talking about releases, you're saying when you have a patient come in and they are, so let me backtrack. Does everyone that comes in to see you, do they all believe or think that they have been through something traumatic and they need to work it out through their body?
It's a tough situation. Some people believe yes, and they have seriously been through an episodic event where it was traumatic to them in some way. Some patients are just coming in because everything else is not working for them. And it's when they start to recognize different modalities in how we treat our patients, that we're not forcing releases on them, that other things will start to come up, those releases of past injury, or we might be working in one certain area because that fascial system is continuous. I might be working on a shoulder, but they're feeling symptoms in their hip or in their knee because it's all connected. There is this web that it infuses everything. So really, the song about the head's connected to the, or the hip bone's connected to the knee bone, it really is connected to the knee bone. So patients coming in, yes, they may have had trauma, or they may have had just chronic pain, a label that was put on them of ADHD or fibromyalgia or any other form of chronic pelvic pain or rib pain or something. They can come in for anything and everything. But yes, trauma is a big driver as to what brings people into the clinic itself.
So are you saying that, again, going back to that example, that even if I'm a healthy individual, I haven't necessarily experienced, in my opinion, any big T trauma, but I experienced that little T trauma of driving, that thing happens, that is in my body. Am I able, as a human being, to release that trauma on my own, or do I need to work through that trauma?
A little bit of both. Everybody needs to be able to work through their trauma. That might be learning self-treatment tools to help you move through that. How that might present with you, it might be the hyperventilation or the inability to breathe or anxiety-driven moments where there's almost like a fist around your diaphragm all the time. So we teach you those protocols and how to self-treat throughout the evening hours or the midnight hours where we're not around to help you, but to give you the empowering tools that you can help yourself. That's the best gift that we can give everybody. Or they might just, really just want to be touched in a certain way or feel safe in their touch of the therapists that are working with them.
Well, I have to say, so I, again, experienced it just not long ago at your practice, and it was, let's talk about what is myofascial release. How do you perform that work? We're kind of talking about it, but for people that haven't experienced it, what can they expect?
Yeah, there's different forms of myofascial release. There's a lot of therapists in Ottawa and around the world that do a lot of structural work. Structural work is a therapist going in and actually releasing the tissue for that patient, meaning it might be more Rolfing or structural integration. Those are the modalities we're trained as therapists.
And so Rolfing is more of an invasive, like it's really rubbing the
It can be gentle, but it can also be quite invasive.
It's like a form of massage.
Exactly. Whereas the treatments that we offer, the John Barnes myofascial release approach, is we engage that tissue so we put our hands on your body, but we engage you at where your body starts to resist. That's where your body starts to push back at us. So we're not forcing the release on you. We're staying at that barrier and holding out anywhere between 3 and 5 minutes or longer.
And when you're saying about pressing into the body, are you feeling something different than what I'm feeling, or are you? Yeah.
Quite often.
Okay.
Quite often. A good therapist will be able to sense a lot of what's going on immediately and follow that guide, intuitive guide, so to speak, as to where they're really connecting to in the body and where they're not connecting to. I speak about energy that might be flowing through the body or not flowing through the body. A therapist can be able to feel where they're blocked in a different area than just their hands. So I'm reaching beyond where my hands are actually touching, and I'm reaching deep within the body of the patient.
Are you feeling the fascia?
Yeah.
You are feeling our fascia.
We're feeling fascia. We're feeling the connection and the interruption that might be had because of an injury or scar tissue, adhesions. We're feeling inflammation that might be going on. We might be feeling an incredible vibrational effect that might be happening in a certain area that's really overactive for patients.
What about emotions?
Definitely.
You are able to, so are you, when you're getting to a place in the physical body that's holding on to an emotion,
correct,
let's say fear or guilt or shame, you are feeling that and you are noticing that it's pushing back, that it's not allowing you to go further? Correct. Is that how it works?
It does work sort of that way, in that when we meet a barrier, so I might put my hands on your shoulder,
yes,
for example, and you're fine in your shoulder, but you were having a little bit of range of motion issues, for example. And then we work through it and we sit there and we wait for a long period of time. Then something might draw me into your diaphragm. Well, why is that going on? Well, I don't have a clue as to why that's bringing me in that direction, but there's a component there that's drawing me to that area. So I might still work in the shoulder because the shoulder was obviously affecting something else in the body. You as a patient might know what's going on. You might not know what's going on. I might give you some direction as to soften into that space, or maybe if you can, go towards the emotion that you're holding on to, because it's a safe space that you're in. And if you're ready to deal with that, then it's a safe space to actually deal with it.
I have to say that, again, being at your practice, it was one of the most beautiful experiences because I didn't know what to expect, and I wasn't sure if it would just be like massage. I came in with sort of a neck pain that I've been dealing with for a little while now, and your thoughts were, I said to you, so is this emotional? Is this physical? Is this mental? What's going on? And you said, sure, maybe. So you don't necessarily know.
No, I won't put a label on it myself. If I do put a label on it, then I'm blocking myself from allowing myself to experience everything that you're experiencing in a way. In that I might be directing you towards something that it might not even be related to. So that would be, wrong of me to guide that treatment towards that, thinking I know exactly what's going on. So I really try to stay grounded and not predicting anything. Otherwise, I'm blocking myself and I'm limiting myself as a therapist to provide you the care that might be needed in that moment.
So would you say that typically people that come and see you are people, like you said earlier, that have tried a bunch of other different things, let's say, and they come in to see you because they don't know where else to turn?
Yeah. Quite often we tend to be the last result for a lot of people. It's unfortunate that that's the way it is. Yeah. We have a lot of practitioners in the city that will refer to us specifically for the myofascial release, in that we do tend to be some of the expert level therapists in Ottawa, which is great. Yeah. And it's starting to grow. So we're really trying to grow that with the therapists in the Ottawa region. But yeah, most patients are being referred in from another practitioner, their medical doctor, somebody, or a lot of them are now they're at their wit's end. They're using Google because Google tends to help a lot of people and drive them into the clinic where, chronic pain or chronic factors have been prolonging them for so long. They just don't know what else to do.
And is that because we just don't really know enough about myofascial release? Is it because, I know it's not a new practice or a new modality, but we're only now kind of hearing about it more?
Yeah, we're starting to hear more about it because the fascia itself, you can't see it. Yeah. It's not on any MRI or ultrasound or X-ray machine. So a lot of the times when you're going to see your doctor for a diagnostic factor of what's going on, they might not say fascia. They might say, it's just tendinitis or tendinosis kind of thing. It's a chronic issue. But it might not even be their shoulder, really, so to speak, because of that system being so continuous. Symptoms that you might be experiencing might not even be the origin of where you're experiencing them.
Well, yeah, and I remember you were sharing with me that some person that has hip pain is experiencing it in their upper right shoulder, and someone else is experiencing it in their knee, and the same type of injury or place, but it's being experienced in different areas of different people's bodies.
Very true, very true. Yeah. It might be hip pain, it might be emotional pain or pain that they suffered as a child. It could be something that they had as an adult. Who knows, right? Again, they're really the only person that might be able to know, but we block ourselves. We block ourselves from those moments of trauma where we don't want to go through those moments again. But we allow them to experience those moments again. We take gravity out of the equation. If patients need to move while they're being treated, they're free to move. If they need to cry, we let them cry. If they need to hit something, hit the table. It's right there. If they need to scream because they got trapped in that scream, then they're allowed to scream.
It's amazing. Thank you so much for being here, Tara. I wish we didn't have to go. When we come back, I'll share my final thoughts. Back in a moment.
.ca.
The first line of Scott Peck's The Road Less Traveled is life is hard. I believe that the strongest people are not the ones who smooth sail through life, but rather the ones who face challenges and obstacles with a willingness to overcome, bravely asking themselves, is this the best I can do? What's so beautiful about the human spirit is that it is resilient. I have seen mothers lose their children to suicide and then go on to speak on their behalf, crusading to spread messages of hope. I've seen people witness horrific accidents and suffer PTSD only to become suicidal themselves before working through the pain and coming out the other side. And I've known women and men battling addiction that stemmed from childhood wounds, physical and sexual trauma and abandonment, all to get sober and share with others that there is always, always hope. What I've learned in recovery from my addiction is that we all have trauma. Life isn't lived without some degree of it, and while not all of us become addicted like I was or develop mental illness or disease, we can all benefit from going inward and seeking to uncover what causes us to think and behave the way we do in our lives. If you are struggling in your life, then I encourage you to get help. Thank you to my guests, Dr. Shelley Jordan, Ryan Theriault, and Tara Hagan-Fields, for raising our awareness around trauma and for reminding us that experiencing it does not make us weak, but rather it can strengthen us in the weak places when we make the effort to heal. Until next time, I want you to remember one thing, that no matter where you are, and no matter how it feels, you are never, ever alone. See you next time.